Okay, hey guys, so we're going to do chapter 24, gynecological emergencies. Obviously, probably not my strongest, but we're going to make it through there together. So we'll get started here. Gynecology, recognition and management of shock associated with vaginal bleeding. Um, the anatomy, physiology, assessment, findings, and management of vaginal bleeding, sexual assault. And that does include the emotional support that comes along with that and infections. Women are uniquely designed to conceive and give birth. Women are susceptible to a number of problems that do not occur to men, obviously. Anatomy and physiology. The female reproductive system includes internal and external structures. The external female genitalia, the vaginal opening, the labia majora and labia minor, the clitoris, and the peritoneum. And here is kind of just a picture. Uh, as far as testing and stuff goes, you need to have an idea, but this isn't something that you just have to absolutely memorize. Anatomy and physiology again. We're going to talk about ovaries. They lie on each side of the lower abdomen and produce the ovum or the egg. Fallopian tubes connect each ovary with the uterus. The uterus is the muscular organ where the fetus grows during pregnancy. The narrowest part of the uterus is the cervix, which opens into the vagina. The vagina is the outermost cavity of a woman's reproductive system. So we've got just a picture there, the front view. You've got your ovaries. You can see your vagina, your cervix, your uterus, um, fallopian tubes. So when a female reaches puberty, she begins to ovulate and experience menstruation. Um, the onset of menstruation usually occurs between the ages of 11 and 16. Any female who reaches uh, this age or that menstruation is capable of becoming pregnant. Women continue to cycle and ovulate during menstruation until they reach menopause. And the end of the menstrual activity usually occurs around the age of 50 is when that menopause really kicks in. Um, really, if a female is old enough to even like consider that they've started a period, um, we need to ask them if there's a possibility they're pregnant. And this is kind of awkward, especially for us guys. And we're going to talk about that here in a little bit. If we have a partner who's female, let's go ahead and have our partner try to work with these female patients. Um, it's just more appropriate. It's safer for everybody. Uh, but asking, is there a chance that you could be pregnant on certain calls is pretty important. Um, Each month, one ovum is released into the fallopian tubes. That's all, the ovulation. The process of fertilization begins in the vagina. Sperm is deposited into the vagina from the male penis. Sperm passes through the cervix into the uterus and eventually ends up in the fallopian tubes where the ovum is fertilized. The embryo travels to the uterus, attaches to the urinary wall, and continues to grow. Um, if fertilization does not occur within about 14 days of ovulation, the lining of the uterus begins to separate and menstruation occurs. Female hormones produced primarily in the ovaries control the process of ovulation and menstruation. Pathophysiology, the causes of the gynecological emergencies they vary, ranging from sexual transmitted diseases to traumas. So we've got things like PID or pelvis inflammatory disease, infection of the upper organs of the reproduction, Occurs almost exclusively in sexually active women. And if infection expands to the fallopian tubes, it will cause scarring, can result in increased risk of ectopic pregnancies, um, and becoming sterile. If the infection extends to the ovaries, it can lead to the development of a life-threatening abscess. Most common presenting signs of pelvic inflammatory disease is generalized lower abdominal pain. Other signs include abnormal. Sorry, I'm trying to read all my notes here. Abnormal um, or foul-smelling vaginal discharge, increased pain with intercourse. Sorry, increased pain with intercourse, fever, general malaise, and nausea and vomiting. The risk factors that we need to check for is multiple sex partners and or a partner who has had multiple sex partners, untreated sexual transmitted diseases, past history of PID, being sexually active across the board there, younger than 26 years of age, douching, and then using an IUD for birth control. So there's a whole lot there just in pelvic inflammatory disease. Sexually transmitted diseases or STDs can lead to more serious conditions such as PID, chlamydia. Most common STD in the United States, usually mild or absent symptoms. Infection of the cervix can spread to the rectum and can progress to PID. Bacterial vaginosis, most common vaginal infection to afflict women ages 15 to 44. Untreated, it can lead to permanent birth or low birth weight, premature birth, wow, or low birth weight. In the pregnancy, makes the patient more susceptible to other serious infections and causes PID. Gonorrhea, caused by a bacteria that grows and multiplies rapidly in warm, moist areas and reproductive tract, cervix, uterus, fallopian tubes in women, urethra in men and women. Severe infection presents with cramping and abdominal pain, nausea, vomiting, and bleeding between periods. Untreated, it can enter the bloodstream and spread to other parts of the body, including the brain. Uh, Possible causes. Vaginal bleeding. Possible causes include abnormal menstruation, vaginal trauma, ectopic pregnancy, spontaneous abortion, cervical prolapse, and cancer. Obtaining an accurate and detailed assessment is critical. So we're moving on to our patient assessment here. Scene safety, always, we got to make sure it's safe for us. Ask ourselves, will we need assistance? How many patients do we have? What's the nature of the illness? Have you taken standard precautions? Especially with this kind of stuff, we need our gloves, probably even glasses. Gynecological emergencies can involve large amounts of blood and body fluids, potentially contaminated with organisms that can cause communicable diseases. Where or in what position is the patient found? We need to pay attention to that. If she is at home, what's the conditions of the residence? So we need to pay attention to, is it clean? Is there animal hair everywhere? Is there animal feces or urine? Is there just trash all over the house? How's that patient taking care of herself? If it's a crime scene, you may be required to testify in court regarding conditions on your arrival. Your documentation needs to be accurate and thorough. Involve the police if any type of assault is suspected. In cases of sexual assault, it's important to have a female EMT provide patient care, which is kind of what I was saying earlier. Even if we need to call someone in from home, This is the safest, best route we can go because we are there for the best outcome of the patient. And no female in sexual assault situations wants a male sitting there questioning them. Mechanism of injury, or the MOI, is some part of the gynecological problem, may be easily understood from the dispatch information, such as sexual assault. In other patients, patient history may reveal the nature of the condition. This is why, at this point in class, we should be getting our assessments down, learning our skills pretty good. That's why it's so important that we get that history and we question those patients. Our primary assessment, we want to form that general impression. What do we first see, hear, and smell? What's the first thing we think? Um, is the patient stable or unstable? Use AVPU. Check that level of consciousness. Evaluate the airway, of course. Is it open or do we need to open it? Breathing, are they breathing adequately? Is it normal breathing? Are they having to work to breathe or do we need to breathe for them? Palpate a pulse. So let's get a pulse, rate and quality, check the skin, color, condition. Is it pink, warm, dry, pale, cool, clammy? Is there any blood loss? Even if it's vaginal bleeding, then that's a chapter we're on. How severe is it? Um, how long's it been going on? Those are the things we need to know. Most cases of gynecologic emergencies are not life-threatening. If a patient has signs of shock, then rapid transport to the hospital. If they're losing tons of blood and they're showing signs of shock, that's a life threat, so we rapid transport. History, we talked about a little bit. Some questions may be extremely personal to the patient, be sensitive to the patient's feelings, and protect her privacy and dignity. Sometimes we're just going to have to kick people out of the back of the truck. Sometimes we need to remove mom and dad so we can talk to a younger patient. Um, sometimes we need to remove a spouse or a boyfriend, whatever. Um, your patient always comes first when it comes to protecting them, because some of these questions get very personal. For abdominal pain, ask about onset, duration, quality, and radiation, provoking and relieving factors, and associated symptoms such as syncope, lightheadedness, nausea, vomiting, and fever. It goes back to that favorite thing I say is common sense. We start putting the puzzle together. Um, we ask these questions and we build the big picture so we can see what the big picture is in the end, right? Let's see. For vaginal bleeding, ask about onset, duration, quality, number of sanitary pads soaked, and associated symptoms such as syncope and lightheadedness. Sample history. Ask about birth control pills. Ask if there's a chance that patient's pregnant. Medical conditions and last menstruation period. So we need to get some vital signs. We want blood pressure, pulse, skin color, orthostatic vital signs. So standing, sitting, laying down. Check the abdomen for distension and tenderness. Check for vaginal bleeding or just ask visible bleeding. Neurological mental status. I'm going to throw in there that we need to get a blood pressure on every patient. That's a vital sign. Or a blood sugar, sorry. Physical examination. It should be limited and professional. Only examine the genitalia if it is necessary to do so to treat the patient. Patients age 65 and older may have concerns related to hormone replacement therapy, cancer, pelvic floor collapse, or urinary incontinence. That's part of our job. We stay professional. We'll be good. For vaginal bleeding, visualize the bleeding and ask about quality and quantity. Observe the vaginal discharge. Fever, nausea, and vomiting are considered significant in gynecological emergencies. Syncope is considered significant. Treat as being in shock until proven otherwise. I think that's pretty self-explanatory there. Assess the patient's heart rate, rhythm, quality. So we've talked about that. Respiratory rate and quality, skin color and condition, capillary refill, blood pressure. Consider obtaining orthostatic vital signs if bleeding is known or suspected. Reassessment. So repeat the primary assessment. There are a few interventions for this gynecological emergencies. So when we are done assessing, we reassess. We continue to talk to them and question them so that we can make sure that their APU remains the same or improves. Watch for those signs of shock. We don't, if the signs of shock aren't there, but we can still give 2 liters nasal cannula if that's going to help comfort. A lot of these people are going to be kind of in a somewhat of a panic, because they don't know what's going on, especially if it is a first time pregnancy or um, some other medical condition. So let's just try to be very, I guess, open-minded here. Communicate all relevant information to the staff at the receiving hospital, include the possibility of pregnancy, maintain the patient's privacy as much as possible. If in a public place, move her to the ambulance, have a female EMT participate in the patient care if possible. We've talked about that. Um, Excessive internal vaginal bleeding, use sanitary pads on the external genitalia to absorb the blood, document the number of sanitary pads that were saturated with blood. The external genitalia have a rich nerve supply. This makes injuries to that area very painful. Um, we take an abdominal pad and we place it over the vaginal opening and we just apply moderate pressure. We never stick anything in there to try to stop the blood from coming out. We don't do that. We do moderate pressure from the outside of that vaginal opening. Treat external lacerations, abrasions, warts, tears with sterile, wow, compressions. Uh, wow, I can't talk today. Under no circumstance should you pack or place dressings in the vagina. Okay, so I jumped ahead. Assessment and management of specific conditions, pelvic inflammatory disease. A patient with PID will complain of abdominal pain. Pain usually starts during or after normal menstruation. The pain may be made worse by walking. Patients often present with a distinctive gait that appears to have like a shuffle. Pre-hospital treatment is limited. Non-emergent transport is usually recommended. So sexual assault, a little different ballgame there. Sexual assault and rape are common in the United States. 1 in 5 women have reported being raped. 1 in 3 women will be sexually molested, often before the age of 12. EMTs called on to treat victims of sexual assault face many complex issues. Issues range from obvious medical ones to serious psychological and legal issues. You may be the first person um, the victim has contact with after the encounter. Professionalism, tact, kindness, sensitivity are important. It's be a listener, be understanding. Once again, if we've got a female patient and we have a female partner or someone we can call, well, let's go that route. When performing your assessment, be aware of drug use during sexual assault or rape to incapacitate that person. If possible, give the patient the option of being treated by a female MT once again. So right there, that kind of makes a good point. Be aware of drugs used to facilitate. So we definitely need to be getting, I know this is a sensitive time, we need to be getting those vital signs and really watching that respiratory just to make sure that they haven't been slipped narcotics because that can knock out our respiratory. Let's see. Your focus should be medical treatment of the patient, psychological care of the patient, and preserve evidence. It may be necessary to Persuade the patient not to clean herself. Often offer to call the local rape crisis center for that patient, take the patient's history, but limit any physical examination if we can, to be brief survey. Uh, for life threats is kind of the only like physical. Check them over real quick. Hey, are you hurting? Are there any other injuries? We can do more talking in this case than we have to physical examination. So there's just I'm not going to read all that. One, I can't see it that well on my computer, but that's in your book. Table 24-1 is treatment principles for sexual assault. And now I think we're going to do a quiz and we're done. What is the narrowest portion of the uterus? Okay, we all good? B. The ovaries are the primary female productive organs that develop embryos, travels into the uterus through the fallopian tubes. The embryos attach to the uterus wall and continue to grow. The narrowest portion of the uterus is the cervix, which opens to the vagina. What is the outermost cavity of a woman's reproductive system? That one's a pretty easy one, so we'll move on. That is C, vagina. Number three, if fertilization has not occurred within about blank days following ovulation, the lining of the uterus begins to separate and menstruation occurs. You can pause this, go look it up if you want, whatever you, we're going to keep moving. It is D, 14 days. The onset of menstruation is called. It'd be that word that I couldn't say, so I just kept skipping it during the presentation. It's going to be B. Which of the following can cause vaginal bleeding? Yep. How about D? All of the above. What is the most common presenting sign of PID? It kept talking about one of them more than all the others. How about C, lower abdominal pain? When obtaining a sample history, which of the following pieces of information is important to obtain? Now remember, it's focusing on this chapter. Because in other calls, no, we wouldn't have to ask all these questions like this, but this chapter, we're going to ask all of the above. What is EMT's first priority when dealing with a patient experiencing excessive vaginal bleeding? So it doesn't matter where the bleeding's coming from. Anytime we have excessive bleeding, we're going to treat that patient for shock and stop the bleed, right? So B. Which of the following drugs is commonly used to facilitate sexual assault? So we've all heard this, just not the entire name. We've heard of roofies. How about rufinol? A. Last one, I think. You should discourage a rape or sexual assault victim from doing which of the following? Yep. D, we don't want them to change their clothes. We don't want them to clean themselves or wash themselves, and we don't want them to urinate. Okay, well, guys, I know this is not my strongest chapter. I apologize about that. I think a lot of it's pretty self-explanatory, especially since we're in an adult class. So let me know if you need any extra help, and I will catch you on the next one.